Hi, I'm Abby Melendez. I'm a ThyCa support group person and volunteer for a whole lot of years with ThyCa. I'm here, and if you're here for what's it? What
Great.
surgical complications and voice issues, something to that effect. Okay, so I'm going to introduce these two fine people. It's my pleasure to introduce Holly Reckers. Ms. Reckers is a hi, Holly. He is a speech language pathologist at Columbia University Center for Voice and Swallowing, as well as an adjunct professor at Teachers College, Columbia University in New York City, New York. She specializes in voice, swallowing, and upper airway disorders. She has presented and published on the topics of vocal hygiene and training of collegiate and professional singers, effects of thyroid cancer treatments on voice and swallowing, and the effects of COVID-19 on professional voice users. So that's Holly. And that other fine gentleman,
He's
hang
not.
on. Yeah, oh, there he is. Okay. Keep going. Okay. Dr. Myssiorek is an ENT otolaryngologist at Bronx Care Health System in Bronx, New York. He's the author of numerous articles on thyroid cancer surgery and other head and neck surgery. A graduate of New York University of Medicine, Dr. Myssiorek did his internship at Lenox Hill Hospital and was chief resident at New York University Bellevue. Dr. Myssiorek is a ThyCa medical advisor. And more importantly, these are my people. Dr. Myssiorek was my surgeon, and yeah, so you guys are so lucky. And Holly was my speech pathologist, and I brought her to the attention of Gary. So without further ado, I guess it's your turn, guys. So go for it.
Okay, amazing. Do you want me to share?
I think you should share now because I do hog the screen, so I would just be quiet for about 40 minutes.
Awesome. So we just have a few slides that we're going to present. Hang on, let me turn off the closed caption. And then we're just going to open it up. And I know a lot of you folks probably have a lot of questions. So we would love for you, if you're willing to share with us some of those questions, and then we will do our best to answer them. So
she will. I'm just going to sit here dodging bullets.
All right. So we wanted to just briefly talk about what a voice and swallowing sort of specialized team typically looks like. So you want to just consider that not all ENTs and SLPs are the same with the training background. So David here is very specialized in voice. So he's an ENT, but he's going to focus more on the T rather than those ears. I don't know. You might like to clean ears and stuff too, but
it's a living.
Yeah. But he's going to be very specialized in laryngology. And then for myself, I'm a speech language pathologist. So yes, I went to school, and yes, I learned how to work with kids on their R sounds and stuttering and things like that. But you probably don't want to put me in the same room with that kid now, because I really wouldn't know what to do at this point, because I've specialized in voice and swallowing now. So that's pretty much what I do all day long, is voice, swallowing, upper airway disorders. And I work with David sort of at my placement now. So although it'd be fun to work together.
We've spent 2 hours together so far.
For sure. All right. I'm just going to advance here. Do you want to do the anatomy review?
Yeah, this will be very quick. This is a human larynx. It's labeled so I don't have to point. But those two structures that make that beautiful white V should look just like that. They should look white, thin. They should elongate when we ask you to elongate them, and they should shorten when you shorten them. The reason that many of you are attending this particular session is because you may have had some sort of injury, not to the structures themselves, but to the nerves that make them move. I don't want to get too much into the physics of this, but I will simply say that the larynx, or the voice box, I teach my residents and students that it's nothing more than a very super specialized valve. It closes to make a voice, or to help you lift things, or deliver babies, or have bowel movements, and to keep you from drowning. And it opens so you can breathe. When we do anything that alters any of those functions, we have problems, which is when one of us is going to get involved, usually. We're hoping that a number of you brought some questions that I'm hoping even more that we can answer, and move on.
Yeah, for sure. And just kind of going back to the slide before, David here, I like to think about this whole voice system almost like your car. He's definitely the mechanic. He's going to get under the hood and see what's going on. I'm more of like a driving instructor. So when it comes to what's going on with your voice and swallowing, if there's medications needed, surgical interventions, all of those sorts of things, that's sort of his realm. And if there's more behavioral kind of changes of like, oh, can you change the way you say that or the way you swallow or exercise, physiology behind that? Of course, there's crossover here, but that's more of sort of what the speech pathologist role is.
But to add, amongst my other skills, I might be, if we're going under the hood, I might be also the person who disconnected your brake line. So just still keeping it real.
All right, so some common issues. We're going to start with sort of unilateral vocal fold paralysis. So if that's one of the vocal folds is no longer moving. And these are very common complaints that people will notice. So they'll maybe say, hey, when I swallow water quickly, I'll explain what that means in a second. They might say like, oh, wow, things just feel like they're kind of going down the wrong pipe sometimes now. I'm noticing I'm sort of choking on liquids more, or maybe I just feel like when I eat something that's solid, it's kind of getting stuck in my throat. From a voice standpoint, loss of stamina, feeling a lot of fatigue is a huge complaint just because you have to work so much harder. If that valve is not closing all the way, then all your other muscles are going to have to compensate. Throat pain can be part of it. Lack of clarity. Clearly, the voice might just sound a bit fuzzy or not like yourself. Some voice breaks or cracking or sort of like pitch instability people notice, especially if they're like a singer. Dyspnea can be common. So that's feeling like you can't really get a nice deep breath or feeling a little out of breath sometimes. Pitch change. So fundamental frequency is, I guess I put that as a little technical thing. The FO just means your pitch, your speaking pitch might be different.
Or you're from the Bronx.
Okay. Air hunger. And then finally feeling like you can't get loud anymore, or staying on voice, sometimes people say, or even sometimes you feel like you might not be able to get soft. I feel that sometimes people feel like they're kind of stuck at one volume level.
For my post-op patients, frequently I will hear, they actually won't volunteer. I will ask them, can you still sing in the shower, or can you still do Bohemian Rhapsody when you're in your car alone? Much to my daughter's chagrin, many years ago, I used to do it when her friends were in the car. But the point is, you cannot hit those high notes anymore, and not right after surgery.
Okay. And then we're kind of getting into now the superior laryngeal nerve injury. So this is the job of this nerve is to stretch those vocal folds. It's one of the main jobs of it. And so when our vocal folds stretch, we should be able to go higher in pitch. So as David was saying, you won't be able to hit high notes anymore. Maybe your range has reduced. You might feel like your voice is kind of monotone. It's not really like, you don't get those peaks and valleys and the nice intonation inflection. Again, difficulty projecting or getting loud, which is a complaint and a realistic issue, right? Like, God forbid you need to call for help and get loud. That's something that we need to make sure you have a way to be able to call for help. So things like that, vocal instability, and then just hoarseness in general. You want to talk about this?
Nah, because this may not.
It's very specific.
Right. So
we'll come back to it if we need to. All right, I'm going to stop sharing. I think we should just open it up, and then we have more slides if we get on a certain topic that we want to talk about.
In full disclosure, we have no disclosures, but I've been in touch with Holly for a few weeks now, just so you know, and I pity this poor woman because, well, Abby knows what it's like to be with me for more than 10 minutes. But we were here for 2 hours because neither of us knew when we were supposed to be here.
We got Mountain Time and Eastern Time mixed up, so he showed up at my house at 10. We were ready to go this morning, got our slides together. We're sitting here at 10:45 and realized we were 2 hours early. So we've gotten bagels already at this point,
I'm
coffee.
Totally jazzed on coffee.
We're ready to go for your questions. And my onion breath.
No such thing.
Wow, that was more than we needed to know, I guess, but that's okay.
Oh, no, we're holding back.
Yeah, I'm back. Yeah, well, so if anyone has a question, raise your hand and then I will walk over and bring the mic to you.
That would be
Oh,
great.
heck, yeah, walk over. Come on, pick it up, walk it over.
Usually do. Abby, can you hear me? If there's a question that's a particular personal, I'd rather avoid it. I'm saying personal, like I hated my doctor. No names.
Questions? Come on, folks, don't be shy. Okay, sure, fine young man coming up in here, and there you go.
Oh, he's coming up.
Oh, yay, we get to see you.
Wow,
Hi.
nice.
Oh, I like the leg.
Well, hopefully you can hear me. So I lost my voice.
Yeah.
I lost a vocal cord nerve in a surgery in June. I'm stage 4 medullary cancer. And so when they went to my neck, it was too bulky. They couldn't get the cancer off the nerve, so they took it off. Or they took it out. I go back December 1st to MD Anderson for them to inspect it. They told me 2 to 3 months, but I'm working, doing everything with his voice. When you said earlier you can't yell, well, I have 3 little kids and it's inconvenient because I can't yell at them. So I clap my hands a lot. So they explained 2 processes that I can go through. One is a steroid injection into one of the vocal cords, but they also mentioned this. Well, I'm not a doctor, so
We'll talk about that.
but they gave me 2 options, and then I think it was hard for me to understand them at the time. The surgery was pretty rough,
Yeah.
but they said something about maybe a synthetic nerve that they can install. So I'd like to hear what you guys think would be the best. Obviously don't know my particular case, but I lost my nerve.
Sure. I mean, I
And,
think we just talk about
and
this.
then
A couple of things, if you don't mind. First of all, have your children genetically tested. Did you hear me?
what's that?
You had a medullary?
A medullary red positive.
Are you familial?
No, I'm sporadic.
He's sporadic.
Okay, I would
He's
still
sporadic, so he doesn't, yeah.
I'd still be very, very cautious about that. But that's off subject, and I apologize for that. But I'm not quite sure about synthetic nerves. They've just taken a woman just this week and transplanted a nerve to her prosthesis in her leg. They were making glass electrodes in Atlanta about 20 years ago, but they never worked. You might simply be talking about an implant into your vocal fold, which we do either by injection or, as I prefer, externally. That's where we make a cut on the outside and implant something into your voice box to push the vocal fold that's not happy over. Can you see this?
Yes, I can.
Okay, so this is more or less a horizontal section through a human larynx, and the purpose of that little rectangle with the arrows sticking off of it is to give that one vocal fold a nudge so it can shake hands, if you will, with the other one. Exactly. So you can have one hand clapping is still a clap, but if this hand is here, it's a no clap. I don't know.
Sorry, go ahead.
No, I'm sorry. I would also tell you that many people will tell you to wait 9 months to see if your vocal fold medializes itself. I don't think that's a good idea. Not in your case. You sound extraordinarily hoarse. And you can be remedied even with a temporary remedy of like a gelatin injection, and you will be better off. And if your vocal fold does meander over to the midline, it'll do it, and you won't lose anything. But you have 3 kids, you need something. How is your work?
What was that? My work.
How is your work? Are you able to do work?
I'm able to work. I work full time. I answer the phone. I talk to customers. I'm a manager for a heavy equipment company. So I talk all day long, and it's by the end of the day, I'm pretty wore out, winded.
Yeah. Okay.
Wow.
Being in Denver, this altitude in Denver makes it hard to breathe.
A temporary injection is probably going to be quality of life wise is important at this point. So I would ask them about it, even if they want to wait for this more permanent surgery, you can still get an injection of what they put in wrinkles, as he said, Restylane or something like that. And that will help plump up the side that's not moving so that the other side can touch. And it's just going to give you a louder and clearer voice for the time being. It might not be perfect, but it'll probably be better than what you have now. So I would definitely ask about doing that. I was going to say from a therapy standpoint, sometimes when people have a paralysis and maybe we're waiting on a longer, more permanent procedure, you can do therapy. In your case, I haven't seen your vocal folds, but based on what I'm hearing, I don't think therapy is going to be too helpful right now, just because it sounds like that one vocal folds are really not touching at all. But that's something that you can consider too, is if you're able to get the one vocal fold to touch better, and then the voice is still not, working for you as well as you'd wanted, you could do a few sessions of voice therapy, and they can give you exercises and strategies to also kind of help you through this. So that's my thought from a behavioral standpoint.
There's one other thing. I'm sorry, I didn't catch your name, and forgive me for being kind of rude here. But the other thing is that when you need to expel this much air to make that much voice, you have to be exhausted at the end of the day. There's no human being who could do what you're doing without being, I'm not talking about just here, I'm talking about all of you being exhausted. So by repairing the valve, by making it more functional, you'll be less tired at the end of the day.
Oh, well, that would be welcome, that's for sure. But I appreciate you guys' input. Thank you very much.
Oh, wait, one more thing.
Wait, Jim. And this is Jim from Modesto, California.
You just my second question. You're from Odessa.
I'm from Central California.
Okay. And you're seeking your treatment at MDA?
Yes, I am.
Okay. They have a new great voice person there. You're in good hands.
Did they say that?
That there is a new person taking care of voice at MDA. You are in good hands.
Yeah. Well, I'm scheduled already, so hopefully that's the one.
Good. There you go. Thanks for coming up.
I wanted to
All right, everybody.
But these are some of what the types of more temporary, and obviously, David, you can talk about it more, but the gel that we kind of talked about, there's the Restylane. These are what we call those trial injections. So it's more of a temporary thing. You might hear like things like a fat injection thrown around, or even silk, which, I don't know if you've used silk. But...
I've not used silk.
Okay.
My tie.
I know a lot of people that I've talked to say that the silk kind of leaves inflammatory issues behind, so they're not happy with it.
Spiders use it.
Yeah. So anyway, but just for your own sake, like if you want to write this down, and like again, we don't know what your whole case looks like, but if you can go into your ENT's office and say, hey, I've heard about hyaluronic acid for this, and just have that conversation. And then there may be a reason why they don't want to do that. I don't know, but at least you can have some information on some different types of temporary injections.
So Jim, you might want to take a picture of that. Can you put the slide back?
I want to butt in a little bit. Jim, something specific to your case is very, very critical for managing vocal fold paralysis after thyroid surgery is if we know that the nerve was intentionally damaged during surgery, I mean, intentionally because there was cancer there, then that's the reason you're not expecting a full comeback in that case. You're just not. In some cases, the surgeon will swear up and down that she or he did not damage the nerve. They tested it electrically. Everything was fine, but the patient did not get a voice after surgery. Those are the ones I personally would rather wait on before I do anything that'll change them.
Thanks for that. Okay. So does anyone else have a question that they'd like answered at this point? I think they just want to glean knowledge from you two fine folks. So.
This?
Well, no,
Wait, we do have a question. Okay. Hey, I'm walking.
I did.
That's cool.
One more thing as the next person's coming up, no questions here yet, is in your case where your voice is very breathy and it is hard to understand you, I would say literally having like a text-to-speech app, you can get them for free, where if you needed, like I said, God forbid you're in a situation where you need to call for help and nobody can hear you, you have a way to alert people just until you're waiting for your voice to become better, or the surgeon to do something. I would recommend just having something like that in your back pocket. Okay.
You're on.
Hi.
All right. Hi, guys. My name is Earl Whittington. I'm from Atlanta. And I've had anaplastic for like 4 years now. And the tumor, when it was removed, was wrapped around the nerve. So they did have to sacrifice the nerve on my left side. I was a singer. Now I'm just a guitar player. Got to learn how to play better. But that was just for fun. It wasn't my avocation. But we waited. I did have 2 injections at Vanderbilt Voice Center, which did improve my ability, but breathing and talking was still rough. And I did have the implant surgery 1 month ago
Oh,
at
great.
Vanderbilt. And I hope you can tell my voice is fairly strong now. It was a marked improvement to have that implant. Actually, when we get back from this conference next week, we go back up there for a follow-up. But for fun, I did ask the doctor if she was going to put that new little AI chip in my throat that I could program with my phone so I could sing like Barry White. She said they don't have it yet,
We'll
but
create
that
it.
may be coming.
That would be awesome.
We're going to be on board. We want to be in on that release for stock when they put it out. But it was a very good experience. It was a long 2-hour surgery, and you're awake basically the whole time.
Remember them asking you to like make sounds or anything while they were kind of tuning?
Yes, I had to count 1, 2, 3 and hum a little bit. And of course, I could see it on a monitor, and it's a little unnerving when you see the scalpel cut your throat. But after I got past that, it was really a great experience to watch them do what they do.
Yeah.
And the results have been very good. My question would be, at this point, would there be any advantage or use of some speech therapy to improve now what I have, what I can do?
Yeah, that's a great question. So you're a month out, you said?
Yes.
Okay.
How long since the initial surgery, the extirpative surgery?
About 3.5 years, almost 4 years.
Wow.
There were some complications and things like that we had to make sure, and the doctors at Vanderbilt, at MD Anderson, everybody wanted to be sure everything else was in good shape, so I could have the surgery. And that's why I had the injections first, just to kind of maintain a little bit. And other side effects, lung issues and things had to be cleared up before they would give the go ahead.
Yeah. Okay.
So it's been that almost 4 years. Yeah.
Okay. I would
God
say,
bless.
you're going back for your checkup visit soon, you said. I
Yes.
think that's a very valid question to bring up at your next appointment, because usually we don't like to do speech therapy like within the first month because there's so much swelling here anyway. It's like you just got to let time is your friend in that situation. You got to let the swelling go down. But I do think it's very valid to ask that question. And, depending, Vanderbilt has a great team, but you said you live in Atlanta? Okay, so
Yes.
you can either see somebody from Vanderbilt. There's a lot of options now, which is great, where you can either see a therapist in person or do a telemedicine option. I see a ton of people from like upstate New York all the time. And I find as a therapist that we're able to get the job done really well in that sense. So you could ask them, or, I know you got Emory probably nearby, things like that in Atlanta. I would say ask them about the speech pathologist. I think it's a valid thing. I don't know how many sessions, they would do with you, maybe 4 or 5, just to kind of give you some tools. And then if singing is an interest of you, usually what I do is we work a little bit. We kind of see, all right, how is the voice functioning? Where are we? We assess all of that. I give you tools. And then I say, and then let's talk about maybe a voice teacher. You know what I mean? Of like, maybe it's once a month, maybe it's once a week, maybe a couple times a year, but somebody that you can continue to work on your singing voice with and speaking voice, because I think that's a very important thing to a lot of people, especially if you used to sing a lot. So that's kind of my thought on the whole situation. Any thoughts from you or you?
Yeah, I'm Mr. Budinsky is here. First of all, and I mean this from the very, very bottom of my heart, having a person who had anaplastic thyroid cancer presenting at one of our meetings is 3 years ago, you didn't exist. So God bless you. I'm so serious about it. This is
Thank you.
change in our field.
I'm happy to be here too.
Yeah, I guess we all are. But the second thing is as I'm listening to you, you actually sound like your bottom range, for lack of a better term, is better than your upper range. I will bet you will improve. But lastly, it's a point for anybody who's in the room or still listening. Your lung function, was that ever an issue?
Not really. Lung function was, breathing was fine. I did have some nodes in my lungs that they radiated. It didn't really have an effect. But
Okay,
it's good.
but for what it's worth, it did. In order for a trumpet player to be able to play the trumpet, she or he has to be able to take a lungful of air and blow it out between their pursed lips. No difference with your voice box. So if you had like real massive radiation to your lungs, you probably would have a real crummy voice. The fact that with all of these things that you're doing this well is extraordinarily encouraging.
That's great. Thank you.
Yeah,
No, thank you.
that's awesome. And your swallowing feels okay and everything like that?
Yes, I have trouble swallowing like the horse pill,
Okay.
but everything else I can swallow. But the
Amazing.
big ones, I just open them up and put them in applesauce.
Great. You're doing awesome.
Whatever.
Love that. That's like star.
Yeah.
I would say, like,
Sorry,
you can, I was going to say, you can bring that up too if that was a problem to your SLP, but otherwise, like, and I think the thing sometimes people are like, well, I'm not a professional singer. Like, I don't know. And I'm like, I don't care if you're a shower singer or on Broadway, like that's still important. So I would definitely bring that up and fight for the care from a speech pathology team. Everybody's overbooked right now. We get it. We're all 6, 8, 12 weeks out, booked out across the country, but it doesn't mean you don't deserve that care. So I would definitely advocate for yourself to get some therapy if that's something you're interested in.
It was interesting at Vanderbilt at their voice center, 2 rooms in the center had grand pianos and guitars. So people there for treatments could go right in.
Mm-hmm.
Somebody could play or they could and try out what had been done.
Yeah.
And I wanted to go in the Johnny Cash room, not the Dolly Parton room. And their walls are lined with gold records and signed. I said, I'm in the right place.
Yeah.
And they were wonderful. And of course, the people at MD Anderson are wonderful for everything that they have done, at least to get me to that point.
Amazing.
So I'm very thankful.
Congratulations.
Thank you.
No, thank you, Earl. So, I mean, we all know if you're here for, for the ThyCa conference, you are all here advocating for yourself. So, I've heard from lots of doctors in the past when, any people ask questions, they're not just the run of the mill questions. People here know what they're talking about, and they get very technical sometimes, and they surprise the doctors quite often. But yeah, anybody else? Okay, come on up, person in the back, and then we'll get you in the front.
Yay.
I mean, to be fair, if I had cancer, you'd know I'd be on Google 24/7 looking up everything.
But you have to watch that Dr. Google because they're scary.
Yeah, exactly. Google is, and my favorite quote about Google, well, it's not so much Google, it's about the internet, is the most famous quote from Abe Lincoln was, "Don't trust the internet."
Oh, yeah. Yeah. I firmly believe that. Here's your next question. Here you go.
Anthony.
If you look on WebMD, you have 3 weeks to live. Isn't that what they say? Hello.
Hi there, I'm Louise and I live just down the street off of Quebec Street where the hotel is. So I'm come very far and I have one of those run-of-the-mill questions. that I
Yeah.
hate to even take up time for people who have such bigger questions and involved questions. I'm 1 year out from a total thyroidectomy that went very, very smoothly. No problems, no anything other than if I talk too long, and I'm not talking about an hour, I'm talking about just with friends and I'm, bantering back and forth. And after 20 minutes, my voice does get raspy. And then I have to say to people, okay, I'm not sick. And I was told that wait for a year and it should go away, but it hasn't. So I just wanted to hear your thoughts before I'll be checking in with my regular doctors anyways. It's time to do that. But
I'm going first because I have the least to say for a change. First of all, don't underestimate drying out. I'm just going to say it right out because if you talk for a long time, that is why I've been guzzling tea while I'm here. But that's a minor point. We published an article through ThyCa on superior laryngeal nerve damage or injuries or what weakness, for any other term you want to use. And we advocated strongly, it was one of the big parts of the paper, vocal therapy. And that most of the patients, about half of the patients who responded, got this kind of problem. It lasted a half a year, got better with voice therapy. But if it's not better by now, I'm lateraling the ball.
Yeah, I would say, I'm going to say it again. I think voice therapy is probably beneficial here. Definitely, I see so many people with the same complaint as you. I think one of the main complaints we see is vocal fatigue and lack of stamina. And so it could be a matter of doing some exercises to sort of strengthen the system and give you more efficiency overall. And then sometimes with therapy, it's, I had a big surgery and things have changed and there might be some permanent changes. And how do I strategize when I'm speaking? So, you may get to the end of therapy and say, I still experience fatigue, but I know what it is now. I sort of know what to do in those situations. And I know how to pace myself so that it doesn't happen as often. I think seeing a therapist, especially you want to see a voice specialized speech therapist, I can't stress that enough because, thyroid cancer and issues, this is so specialized that you want to make sure you're working with a speech pathologist that knows like how to work with that specific issue. So I think you're in Denver, right? Yeah, I think you guys got a pretty good team right around the corner. So I would definitely reach out and again, make sure nobody's brushing you off. If you want therapy, make sure you get it.
Yeah, and you know what?
thank you.
There's no such thing as a small complaint. If it were, you wouldn't be here. That's our purpose, right? Our purpose is to, help.
And by the way, it's so funny because, and I teach students all the time and I have them with me in the clinic, and we were having this conversation the other day I had somebody come in, very hoarse voice, I would say, and it wasn't thyroid related, they just had a very hoarse voice. And they're like, no, I'm here because my ears are waxy. And I'm like, well, how's your voice? They're like, it's fine. I'm like, okay. And my student was like, don't they need therapy? And I was like, well, they can communicate fine. Their voice is happy for them. And yet the next person that comes in might have, to my ear, completely normal sounding voice, but they're complaining of things like fatigue and tiredness or soreness. And I'm like, that person, then we should give therapy. It really is based on your complaints and your goals.
One last question. Did you get radioactive iodine?
No, I'm one of these really blessed people that sailed through everything.
For anybody else who's managing to listen, if you had radioactive iodine, it is a slight game changer because it does radiate your minor salivary glands.
Yeah.
So your larynx has about 60 minor salivary glands per side. And if they get dried out, they're called the oil can of the larynx. Then your vocal folds will be a little bit dry. And if they're a little bit dry, as mine are right now, you have to overdrive the system, which makes you a little bit hoarse, tire you out at the end of the day.
Yeah.
Okay, thank you.
I think it's great to
Next.
get some therapy.
We have a new person. Yeah, I mean, everyone wants to have whatever is optimal for them.
Yeah.
And advocating for yourself is it. So here we go. Next person.
I somebody that had a knee surgery, I would be like, yeah, you need to go to physical therapy. Hi.
Hi, I'm Barbie Jordan, and I was treated in San Diego, California. Hi, hello. Um, um, I I was in 2013, lost my voice, October 1st, and never completely got it back. After surgery, I lost the right nerve, as many have said here, and had a monotone, very raspy voice. So, at my insistence, they did do the temporary injection. And when that wore off, they did a more permanent, they said 3-year. And
Injection?
after, yeah, it was another type of injection that they said would last about 3 years.
Okay.
It has lasted longer in the sense that I still have a decent voice when it's working. And it just randomly, I never know for sure when it's going to be super raspy. But I had problems arise where I started getting like little sores around the vocal cord area that will hurt really badly. And they basically said, because I'm straining to talk.
Is it a granuloma? Do you remember that term?
They did not say, they kind of just said it was like an ulcer, but a lot of them have just dismissed it. They don't always see it because it flares up and then it goes away if I stop talking for a few days. So a lot of times by the end of the day, I may feel like I'm on the verge of strep throat. And then by the next morning, it'll be absolutely fine. My voice will wear when I'm in a crowd or with friends, start coughing when I'm talking. So then you have the looks from people who think you're coming down with COVID. And so,
You're down.
but I mean, I'm not, complaining, too much because I do have a voice and I'm glad. But of course, if there's something I can look forward to as the best option, should I just do therapy? They are monitoring because I may be starting to get some fluids in the lung. So it may be time to do the next injection or next treatment.
Are you having dysphagia? Like, are you having things go down the wrong pipe when you swallow? What do you mean there that you're getting fluid in the lungs?
They said they saw something in the lung and they want to check my vocal cords, my next visit next week.
Okay.
And they, to make sure that that's not what it is. But also I cough sometimes after eating or during eating. I have food get stuck.
Okay.
Bobby, I've got a number of questions. I'm asking you now as a surgeon, okay? When you say have fluid in the lungs, is it in or around?
They, at the last scan, said there was something there that could have been caused because of debris getting into the lung. I'm not sure what that means. So they just said at the next visit, they're going to see if it's gone and have my vocal cords checked.
Have they done what's called a modified barium study on you yet? If they're worried
Like swallow study.
If they're worried about you aspirating, that's the next step.
Yeah.
Yeah. The last time I believe I had that done was in around 2015.
Okay. I mean, that's what I would say first. Like, if they're concerned about aspiration, any of those like materials landing in the lungs, you want to make sure you know what the pathophysiology of the swallow is, meaning that they need to do a swallow test. And I totally agree. Like, there's two types of swallow tests. There's a modified barium swallow study where you go into the x-ray unit and you swallow barium and they watch you go down. And then there's the fees, if anybody's had that before, which is they put a camera in those, they watch you swallow usually brightly colored dyed foods. I would say in your case, the modified barium swallow, the one with the x-ray, is going to be more important. The other thing is, it's like in the case of vocal fold paralysis and dysphagia, like just because the vocal folds are approximating better doesn't mean your swallow is going to get better. Like that's a whole nother like area that I would say, like, if you've never worked with a dysphagia or swallow therapist, if swallow is a big issue, you know, you might want to just like see and go down that road a second and make sure everything's okay. From a voice standpoint, have you done voice therapy before?
I only went all those years ago where they gave me some suggestions on when I cough,
Okay.
a few suggestions on swallowing, but because I live an hour away from where I was going in San Diego, I had to move when I no longer worked there.
Gotcha.
I just switched to MD Anderson this year, so I'm checking with them. And I also go to UCSD
Okay, great.
and, you know, keeping trying to
Yeah.
follow up on it all.
The good thing is like, especially for voice, it's so easy now to hop on a platform like this and do therapy. So you have access at your fingertips to some of the best voice therapists in the country now, depending on where they're licensed. Like I can't see somebody in California because I'm not licensed there, or somebody in California can't see somebody in Atlanta. But if you find a center that has a good team, then you can talk about getting therapy and then still staying at home and seeing them online, which is nice. That's my thought. Anything else you want to add?
Yeah, a couple more things. What kind of thyroid cancer did you have?
Anaplastic?
I'm sorry, I'm gonna have to repeat this whole speech again.
Yeah, David, this is another one of our fine ATC people who are at the virtual support groups. There are so many people at the support groups. Yes, it is so worthy of claps. It's amazing. Yeah.
The surgeons should be coming to the support group because I think we needed it as much as you did. So yeah, I think honestly, getting an X-ray or even a CT scan is not going to tell you if you're aspirating. My concern is that they're worried about the 800-pound gorilla in the room visiting you again. But if they're telling you to just wait, that means their index of suspicion is present but not high, right? If they thought, you would have had a bronchoscopy by now. So thank you for making me breathe easier. But I think that the advice you were just given is really important. But I'm going to say something that's not particularly self-serving. Yeah, you in particular have to stay in a major institution setting. I know I'm going to be wrong. I'm going to get pushback from a few people, maybe even from Holly. But you don't, when you have a high-end problem, stay high-end. If you had liver cancer, I don't know that you'd want to, stay in Binghamton, New York to get your liver treated. Understand? You have specialists upon specialists. You have specialists. And that's really, in your case, every bit of timing and coordination is kind of critical.
Yes, I was HMO at first, so I got what I got. And thankfully, I was given some very good oncologist and ENT at the time. But eventually, of course, their knowledge, they said they were, asking MD Anderson what to do. So now I go there because my insurance allows me to.
You got external beam radiation?
Yes, I've also had RAI a few years later for nodules in the lung that partly are resistant, but the other part took up RAI, so it reduced them by 50%.
More good news. But the radiation alone has I already mentioned about the oil can of the larynx. You are very, your vocal folds are particularly dry, yours, because of the external beam radiation. What that does is it reduces elasticity of the cover. The vocal fold is a cover. There's a cover, like a blanket, that if it's too tight or too dry, or if you short-sheeted yourself, it's not going to vibrate. And if it's been radiated, I have a study out there from years and years ago with my speech therapist. Actually, she did the writing. I just signed off. She, is that if you've been radiated, you're going to have, maybe not perceptible to a normal ear like mine, but Holly would hear a difference. And I suspect now that we know that you're radiated, we both hear a difference. And that's more of an explanation. I don't know that you're necessarily getting sores. You might be getting something called leukoplakia, which comes and goes. And it's white membrane. If they ever show you your own video, it'll look like an irregular map on the vocal fold. We frequently are scared to death about these things because they can be something else. We'll biopsy them. We're usually pleasantly annoyed that they're nothing. Pleasantly annoyed mean we're annoyed that we put you through something, but pleasantly because at least we know that we can breathe easier. But radiation is a game changer.
Mm-hmm. My other thought was, did they give you any sort of long-term exercises to do for your swallowing since you had radiation?
No, not really. They gave me a few stretches and I continued to do those, or,
Great.
Google.
Okay. Yeah. I mean, I would definitely bring that up as well and just say, with this radiation that I had, unfortunately, we know radiation is the gift that keeps on giving, is what everybody says. And you just want to make sure that you're continuing to do some sort of stretching, swallowing kind of exercises. I mean, the best exercise for swallowing is to swallow. So like the fact that you eat is a good thing. But there are other things that you can do just to make sure that this fibrotic tissue doesn't become more and more stiff, so that the swallowing and the voice and things like that get worse.
That is what I've noticed in the last couple of years, the struggle as it keeps tightening.
Yeah.
And, trying to figure out, and I can't swallow pills. So I've learned how to stick a pill and let it dissolve and suffer.
Yeah, but the fact that you're still swallowing, even though you have to do it a little bit differently, is good. And then even from a voice standpoint, a lot of people start to say, oh, I just am not using my voice as much now. I don't like the way it sounds. I'm trying to be quiet. I'm trying to rest. You don't want to rest. You actually want to make sure you still talk and you're still using your voice every day, because as soon as you start to pull back and go on voice rest or not talk as much, that's when the stiffness is going to start to take over more and more.
Oh, that's good to know, because one of the surgeons told me the more I talk, the more I wear out the actual injection, the sooner I would have to get another one.
Yeah, no. I mean, within reason. And I should say, it's not like talk until you drop dead, right? Like you want to talk
right
within reason, comfortable, but think about these muscles like any other muscles in the body. If I'm going for a couple mile walk a day, great. If I'm laying in bed all day, not so good, right? Like you have to use your voice in a good way that's healthy, right? I'm not saying you have to run a marathon every day, but that's
okay. Great. Thank you so much.
welcome.
Thank you. I think we have about 10 minutes, right? It's till 11:45 here in Colorado. I don't know. What time is it there in New York? In Jersey? You're in Jersey?
No.
We're in Jersey. It is 1:37.
Yeah. Wow. Anybody else have any questions?
No.
So, oh God, I get the open mic. Okay, I'm going to do my best Barry Manilow. No, we have never done this together. All right.
No, that's cool. I'm so glad how did this come to be? I'm curious.
Gary.
Yeah. Gary.
Yeah, Gary emailed about a month or so ago me, and he was like, do you want to present? And then I said, oh, well, is there anybody else presenting, like an ENT or anything? Because I don't want to overlap. And he's like, as a matter of fact, there's this guy named David. And I was like, oh. So then he was like, why don't you guys present together? And then Dave was like, well, I'm in the Bronx. I'm like, do you want me to drive to the Bronx? He's like, no, I'll drive to Maplewood.
All right. I'm glad that worked out.
We've never done this before, and this to me is like, this is eye-openingly pleasant. Having said that, in open disclosure, the name of this session was also supposed to be surgical complications. Now, fortunately, I'm not an expert at surgical complications. But I will say, do you know if anybody's there for non-vocal issues?
Is there anybody here for non-vocal issues? Anybody had surgical issues? I, of course, did not, because David was my surgeon.
Yes.
Yeah. And the telehealth for the speech worked, because I think we went in to see Holly once, and then I think I saw her a handful of times like this, and
Yeah.
there you go.
Yeah, by the way, telehealth does not work for gynecology. My wife found out firsthand.
Thank you for that, everyone. And this is how, this is Dr. Myssiorek. Yeah, so and it is a wonderful thing that we have a lot of people here who are ATC, who are MTC. There are a lot of first timers here, so it is wonderful.
It's great.
I want to stop talking. You guys can talk
Because
amongst yourselves.
it's open mic time. So I'm going to say this. I will not tell you
Yeah.
what cancer I have, but I'm a cancer. I'm always afraid to say survivor because if you go, then tomorrow.
You are. You have 5 minutes. You have 5 minutes. So no, that's fine.
Yes. I know the first or 2 years after my cancer, I was grateful to be around. After that, I started getting angry about all the baggage that I was left with because now, now that it looks like I might have a shot, I wanted more. And cancers, their treatment and the cancer itself will rob you of a lot of things. Maybe the most important thing it robs you of is confidence in your own body, because your body used to be your friend and then suddenly it joined the other side. And I'm not going to get political. I'm just saying that the fact that you guys are here, nobody attends a ThyCa conference. Oh, that's a bit of an overstatement. Very few people attend a ThyCa conference who are doing extremely well, which the majority of ThyCa folks are. They're doing extremely well. For me, maybe I'm going to get more from this conference than I've ever gotten before because of two of the people that got up and asked questions. And with that, I've been on a ThyCa panel now for its entire existence. And we didn't have a meeting like this 5 years ago. That's all I can say. So hats off. You make me want to wake up in the morning.
Yeah. All right. So if at this point, if no one has any more questions, I guess we can say goodbye to Holly and to David. And and clap, clap, applaud, applaud. And take care of you folks. Yeah. What?
Evaluate us.
Oh, are they evaluating you? I think so. Although I haven't seen anything. We will find out.
Okay. I don't think
Everyone check plus. Oh, all right. Well, okay. I think that's it, guys. Have a good afternoon. Or
Bye.
pleasant evening. Bye-bye. Bye.